You think about surgical innovation, it's oftentimes related to device manufacturing. So is there a new tool you can use in the operating room? We've allowed ourselves to be more broad. New ideas are often in research, they're in quality improvement. But when you add that commercialization aspect to it, it really changes the scope in terms of how you think about an idea.
Translational research, innovation mindset is not something that's necessarily taught within medical school or clinical training programs. The Michigan Surgical Innovation Accelerator course offers funding, education resources, and team building for faculty to cultivate their ideas over 6 months.
Our goal is to train as many people as possible, so we'd rather be inclusive. Our ask is that for projects that are not necessarily started by Department of Surgery faculty, that person allows a Department of Surgery faculty to be associated with that team, as well as a Department of Surgery resident. That way we can maximize the investment and the educational component of that.
Our Surgical Innovation Discovery course is specifically designed for residents. We have a lot of competing priorities and responsibilities, but they still want to innovate.
Our goal is to make the innovation pathway a viable alternative for some of those surgical residents as part of their academic development time.
I am a surgical innovation fellow. I'm working on developing surgical devices. So I've got a few projects going on in the fields of cardiac, thoracic surgery, and OB-GYN. CSI in general is a great way to connect to the huge number of resources at the University of Michigan for innovation.
We need to build teams to support these ideas, these innovations. And so what we've done is approach the engineering school as well as the business school, and we are finding partners for each one of our teams.
We were able to faster prototype our ideas and be able to de-risk them. It's been a great relationship to be able to create business plans, figure out the market for our ideas, and how ultimately they could be commercialized.
It's really a numbers game. Someone's going to have 20 ideas, and maybe one of them will be successful. But by going through our program, people will understand what the steps are to get through that. We are part of a mixed reality grant with the National Science Foundation and the FDA, as well as the University of Maryland. And there we're focused on how do we get augmented reality, virtual reality into healthcare over the next 5 to 10 years. We have industry partners, including right now Sony, Microsoft. Those industry partners have a vested interest in the success of mixed reality in healthcare, or mixed reality overall. Our focus, though, is how do we bring that mixed reality into healthcare.
We have an opportunity to see and hear from the folks that are doing this amazing work. We want to learn. We want to understand how we can make our products and offerings more valuable and relevant. We can share best practices. We can show exactly how things are done.
There has been innovation from our Department of Surgery for years. And my metric, honestly, I'm more focused on is the education component. Because I want everyone to have the tools.